There's these cases, by the way, in World War I where soldiers would drag their buddies to the medic and say, medic, my buddy's dying. You need to help him. And the medic would look at the soldier and say, soldier, your arm is gone. And he'd look and he wouldn't notice that half his arm is missing because pain requires attention. So when we overfocus on our pain, when all we pay attention to is our pain, and I'm saying here physiologically as well as psychologically, the pain becomes worse. The pain becomes worse. When we say, and more so, when we try and not do the thing that causes us pain. So now the advice is not, if you have a back pain issue, it used to be, okay, well, immobilize, don't move, don't stretch, don't just, rest. And now the advice is really changing. Same with carpal tunnel. It's not, get all the wrist braces and don't move your wrist. It's the opposite. Is if you feel back pain, do whatever caused that pain 3 times. Because you want to regulate the brain to learn that this is not a threat. Again, emotions, pain don't happen to us. They happen for us. It's a lesson for us to learn from. It's just a signal. Now we can interpret that signal any way we want. So when we hyper-focus on something that was painful, physiologically or psychologically, when we don't do the thing that caused us discomfort, right? When we want to go to safe spaces with trigger warnings and we're not exposed to the things that make us uncomfortable, that only makes it worse and worse and worse because we're paying more attention to it and we don't have the exposure. We know the way to treat phobias. How do you treat a phobia? Exposure therapy, right? So when someone's scared of a dog, right? When someone has severe reaction to a dog, what do? Well, first you show them a picture of a puppy. Then you show them a picture of a full-grown dog. Then you show them a video. Then eventually you put them in a room with the puppy out the other side of the room, 20 feet away. Then you expose them to the threat until their brain downregulates and teaches itself not to cause this reaction, this emotional reaction to this potential stressor. And so it's the same way with many of the potential discomforts in our life.
Isn't it the same way with just belief itself, like self-belief? You think about how our beliefs form. People always, ask me questions, and one of the most popular questions anyone wants to know in this sort of self-development community is about how we become confident. And confidence is a belief. And one of the ways that I've become confident in my life is by exposure therapy, I guess.
Yeah.
How you learn to speak on a stage is by doing it. Like there's no other, you can't read a book on it to get to overcome the nerves. Have you thought much about confidence and the role it plays in everything we've discussed today and how to build confidence?
Funny you should say getting on stage. So I'm a professional public speaker. I do that a lot.
It shows.
Thank you.
Very good.
Well, okay. Well, let me back up a few years. So when I first started out, I wrote the book first, and then I started speaking about it. And when I would get on stage, I would have incredible stage fright. And at first, this is with my first book, Hooked. And I would tell myself this script of when I felt my heartbeat, when I would get sweaty pits and I get very nervous. And I tell myself, it's funny just talking about it, I can actually feel it. I would tell myself, if I was a real public speaker, I wouldn't feel this way. I'm going to mess up. I'm going to stumble over my words. I'm going to fall flat and people are going to laugh at me. And I would do worse on stage. And then when I started researching Indistractable, I found this technique called reimagining the trigger. And reimagining the trigger is when we take the same exact physiological reactions and we reinterpret them. So now when I go on stage and I feel my heart racing, I don't use the old script. I have a new script. The new script says, my heart is beating fast because it is pumping oxygen to my brain so I can deliver the best possible talk. That's where confidence comes from, is reframing the triggers. What used to scare you should embolden you, should strengthen you.
Someone that's low confidence, are they lacking in something? Are they lacking in positive evidence, or are they abundant in negative evidence? I guess it can be either or.
I think they're stuck to a script, frankly.
Okay.
I mean, this is why we see Michael Pollan's book, How to Change a Mind, why psychedelics are so interesting for treatment of depression, anxiety, and various conditions. It's not the drug itself, right? There's no healing taking. I mean, even the whole concept of the broken brain and chemical imbalance. This whole chemical imbalance theory turns out it's rubbish. Nobody believes it anymore in the psychology community. It's only the public that thinks that there's a brain chemical imbalance. It's not fixing anything in the brain. It's simply showing you that a different perspective exists. That's all it does. It simply shows you that a different perspective exists. And that can snap you out of this, what we call a trapped prior, a trap belief around how things are, and says, wait a minute, I don't have to think that way. So when it comes to confidence, I mean, what do actors do? Actors inhabit completely different characters on demand, right? And that's a skill I think we could try on for size. We should actually once in a while say, well, what would it be like if I acted different, right? Do I have to stick to my old beliefs? No, there's no law that says you have to act the same way every day. It's simply that our sense of self, our self-image is based on what we did previously.
A topic that's actually emerged a lot in public consciousness and conversation since we last spoke is, and it's very much linked to all the work you do, is attention deficit disorder.
Mm-hmm.
You wrote a book about not being distracted.
Mm-hmm.
What's your thoughts on ADHD, ADD?
Oof, this is a big topic, and I'm probably going to get myself in trouble here. But let me start by saying it is not up to me or anyone you would listen to on a podcast to tell you whether you have or don't have a diagnosis. Go to a physician and get a diagnosis one way or the other. I will say that I think there's something fishy going on when it comes to ADHD. I have a lot of concerns. One, the discrepancy between what's happening in the States and in Europe is weird, right? 10% of children in the United States are diagnosed with ADHD. In Europe, it's 1%. Something's strange there, right? There's something about the culture in the United States that I believe overdiagnoses. And it overdiagnoses because I don't think there's a great check and balance to disincentivize the diagnosis. Meaning, if a teacher says, this child is a pain, this child can't sit still, and we're talking about, many times 5, 6, 7-year-olds where, it's funny. A lot of people say how technology is this and technology is that. Public education is also a technology. It's only about 150 years old. It's not that old. We haven't done it for that long, and so there are negative repercussions also to putting a bunch of kids in a box and expecting them to sit still and be quiet and listen to some boring person lecturing on at the front of the classroom. So I think there's a clear incentive for teachers and parents to try and calm kids down. And I don't know if there's enough of a check and balance to say, look, is this really necessary to diagnose, especially when there are pharmaceuticals involved. So I like to repeat, and I'll repeat it again and again, skills before pills. Skills before pills. ADHD is real. These diagnoses, and for many people, medication is the appropriate course of action. But I have talked to so many people in the field who just don't have the resources to teach skills, and so all they can do is prescribe. And it's the first thing they'll do. The kid will get diagnosed, here's some pills. And I think those pills, we do not properly weight how dangerous those pills can be. Not only, look, these things are amphetamines, right? They have consequences. They have side effects. And many times we will give pills to take care of the side effects of the pills we just diagnosed. And more importantly, they are training a generation to believe that solutions come in pill bottles. And I think that has some very severe potential consequences, especially when, for many, many people, adults and children, the skills are here, right? If you have tried the skills and they still don't work, if you've taken, a day or two, just a day or two, to learn some of the skills that I talk about in Indistractable. And then if you find, it's still not working, okay, got it. But to jump straight to the pharmaceuticals, I think is a big mistake because they all come with side effects. So skills before pills.
The justification that I got from one of my friends that was diagnosed was that his brain doesn't make enough dopamine.
That's not true. We don't know that. That's pure conjecture. The science doesn't support that. The whole chemical imbalance theory, no psychiatrist will tell you that's true. It doesn't. That's just scientifically false.
Where did that come from?
It was a theory that has since been discredited with further research. We actually, you cannot find ADHD in the brain. There's no brain scan to say, there's no blood test. You go to a doctor, they will ask you questions, you'll take a little assessment, and then if you get whatever it is, 6 out of 8 of these criteria, by the way, very gameable, completely gameable, you'll get a diagnosis. And of course, many physicians, unfortunately, will cater to what they think the patients want, because they don't want a bad review on Google that says this doctor didn't believe me, right? So they fear a bad review, and they'll do what the patient wants. Furthermore, I think a big problem. Okay, again, this isn't black and white. I'm very much for a proper diagnosis. I'm sure that ADHD is absolutely real. Let me say that again. But if you go to a physician that does not also give you an undiagnosed plan, everybody thinks about diagnosis. What about undiagnosis, right? When you go to the doctor and you have a broken arm, they put on a cast and they say, come back in a few weeks, we'll take the cast off and you'll be healed. Where's the undiagnosed plan for ADHD? It should exist. It should exist. We should be able to help people overcome, and we see this all the time when people want to. In my family, I've seen this. People in my family have been diagnosed with ADHD. They go on medication. They suffer from the consequences of some of the side effects. They go off the pills. Then they get to the skills. They learn the skills, and they functionally don't have it anymore. Remember, it is not. What I hate about a lot of people in the ADHD community, they feel like it's an identity, right? It is who they are, and that is so dangerous. We need to look at ADHD as something that is treatable, okay? It's treatable sometimes through medication. It's treatable through behavioral practices. We can learn to overcome many of these things, because if it's not functionally hurting you, you shouldn't have a diagnosis anymore. But I think if you go to a physician that doesn't give you some kind of undiagnosed plan, which could take years, it's not an instant solution, but there needs to be some kind of plan to how do we make sure that this functionally doesn't debilitate you without medication as a constant course of treatment, especially when it has side effects. That's a big red flag.
The treatment is based on what people believe the cause is. So if I think the cause is a chemical imbalance or your brain is broken in some way, I can't create an undiagnosed plan.
Right. That's the problem. It's not. Look, people are cured of addiction. Addiction is a pathology. You have it for a while you're so addiction is a confluence of three things: the person, the pain they're going through, and the product that they are addicted to. But when any of those three things change, they're no longer addicted. I don't believe in this, I'm an addict for life. I think that's incredibly harmful. And you will be very hard pressed to find someone who's in the addiction treatment community who calls people addicts. We don't call them addicts anymore. We call them people struggling with addiction, because we don't want to stigmatize them to believe that's who I am. What do people do when they have an identity? They conform to that identity. That's terrible. You struggle with an addiction for a while, and then you are treated, and then you recover. Why do we think that ADHD would be any different?
The BBC wrote an article this week, which is what sort of caused this discussion amongst my close friends, where the BBC said they kind of presented the idea that TikTok had been really driving an overdiagnosis, because on TikTok you'll see a lot of videos that say things like, if you have this problem and this problem, you can't focus on this, or you lose your keys a lot and you forget where you've put them, that's ADHD. That's ADHD. It's kind of simplified the ailment. And the BBC wrote this piece sort of saying that, is it driving an overdiagnosis in culture? And I've seen, if I go on my social media, that's what I see. I see so much content around saying, well, if you've got this, this, and this, if you've got this habit, then that's ADHD. And that does concern me a little bit, because we both know that ADHD is a very real thing that can be debilitating for people that suffer with it. But trivializing it into small little.
Right. And if you look for it, right, it's recency bias. When you are looking for something, you'll find it. So if do people everyone who loses their keys from time to time have ADHD? Of course not.